If you're over 60, there are certain pills you may be taking right now that cardiologists say can quietly increase the risk of heart attack or stroke. These aren't rare drugs or experimental treatments. They are common medications that millions of older adults use every day. And that's exactly why this topic matters. Many of these medications were prescribed for good reasons, but the body changes after 60. The heart, kidneys, and blood pressure system become more sensitive. A medication that once worked smoothly may begin affecting the body differently. The warning signs are often subtle, unusual fatigue, dizziness when standing, ankle swelling, or shortness of breath that gets blamed on aging. Most people never connect these symptoms to their medications. Before we begin, I'd love to hear from you, and I personally read every comment. How many medications do you currently take each day? Let me know in the comments below. Today we'll walk through 5 common types of pills that cardiologists say deserve a closer look after 60, so you know what to watch for and what questions to ask. Let's start with one almost everyone has used at some point. Pill 1. Common painkillers, NSAIDs. The first pills cardiologists often worry about are painkillers many seniors take every day. These are common painkillers known as NSAIDs, including medications like ibuprofen, naproxen, and diclofenac. Many people take them for arthritis, joint pain, back pain, or the everyday stiffness that can come with aging. They're effective, which is why millions of older adults rely on them. But after 60, the way these medications affect the body, especially the heart, can quietly change. These painkillers don't only reduce pain and inflammation, they also influence how the kidneys handle salt and water. When that balance shifts, the body may begin holding on to extra fluid. When fluid builds up, the heart must work harder to move that extra volume through the body. For an older heart, that extra workload can slowly become a problem. The warning signs usually appear gradually. You might notice swelling around the ankles or feet by evening. Shoes feel tighter than they used to. Walking short distances leaves you more breathless. Fatigue appears during activities that never used to cause trouble. Many people assume these changes are simply part of aging, but sometimes a regularly used pain pill may be adding pressure behind the scenes. Another concern involves blood pressure. NSAIDs can raise blood pressure or reduce how well certain blood pressure medications work. This means someone carefully managing their blood pressure may still see numbers slowly creep upward. Risk also increases when these painkillers are used frequently, not occasionally, but several times a week or daily for ongoing pain. This becomes even more important when NSAIDs are combined with blood pressure medicines or water pills. That combination can place additional stress on the kidneys, which in turn affects fluid balance and places even more strain on the heart. None of this means you should suddenly stop these medications. Pain deserves treatment. But after 60, regular use of NSAIDs deserves a closer look and a conversation with your doctor. Pill 2, anxiety and sleep pills, benzodiazepines. Now let's talk about anxiety and sleep medications known as benzodiazepines. These are pills many seniors rely on quietly to calm nerves or help with sleep. They're often prescribed to reduce anxiety, ease tension, or make it easier to rest at night. Common examples include medications like lorazepam, diazepam, and alprazolam. Many people recognize them by brand names used for anxiety or sleep support. For many adults, these medications bring real short-term relief. But after 60, the way these pills affect the body can change in ways most people are never warned about. These medications work by slowing the nervous system. That's what creates the calming effect. But the nervous system also controls breathing, balance, heart rhythm, and stress response. When the system slows too much, the entire body can become less responsive. For older adults, this often shows up in subtle ways. Breathing during sleep may become shallower, and oxygen levels can dip slightly without you realizing it. When oxygen drops, the heart must work harder to keep the body supplied. Over time, that extra effort can strain the heart, especially if there are already heart or lung concerns. And most people have no idea this is happening because it occurs while they sleep. Another concern is balance. These medications can slow reaction time and affect coordination. That increases the risk of falls. For older adults, falls often lead to hospital stays, surgeries, and long recovery periods, all of which place additional stress on the heart. Long-term use is another issue. Many seniors start these medications for a short time but stay on them for months or even years. Over time, the body adapts. The calming effect may weaken, but side effects remain. People may feel unusually tired, mentally foggy, or unsteady when walking, symptoms often blamed on aging. Stopping these medications suddenly can be dangerous, so changes should always be supervised by a doctor. Before we move on to the next pill, please take a moment to like this video and subscribe to Senior Revival, where simple changes for seniors can lead to a powerful, healthy comeback. Pill 3, Acid-Reducing Pills, PPIs. Now let's talk about a pill many seniors take every day without much concern, acid-reducing medications known as proton pump inhibitors or PPIs. These pills are commonly used for heartburn, acid reflux, and stomach irritation. Many people recognize them as medications like omeprazole, pantoprazole, or esomeprazole. They're effective because they reduce the amount of acid the stomach produces. For short periods, they can be very helpful. The concern begins when they're taken daily for months or years, which happens quite often after 60. Here's the part many people are never told. Stomach acid isn't only responsible for heartburn. It also plays an important role in helping the body absorb certain nutrients. When stomach acid is suppressed for long periods, absorption of nutrients such as magnesium, calcium, and vitamin B12 can gradually decrease. These nutrients are important for the heart. Magnesium helps maintain a steady heart rhythm. Calcium plays a role in how the heart muscle contracts. Vitamin B12 supports healthy nerves and blood cells. When levels slowly decline, the effects may be subtle at first, but over time they can affect how the heart and muscles function. Many seniors on long-term acid pills begin noticing symptoms that don't immediately seem connected to the medication. You might feel more tired than usual, notice muscle weakness, experience occasional heart flutters, or feel lightheaded without a clear reason. Because these symptoms appear gradually, they're often blamed on aging rather than medication. There is another factor many people don't realize. Long-term acid suppression can also change the balance of bacteria in the digestive system. When gut bacteria shift, it can increase inflammation in the body. Over time, inflammation places additional strain on blood vessels and the heart. None of this means acid-reducing pills are harmful or should never be used. They can provide important relief. But after 60, long-term daily use deserves periodic review, making sure the dose, timing, and need for the medication still match the body you have today. Next, we'll talk about medications designed to protect the heart, yet can sometimes create new challenges as the body changes with age. Pill 4, Blood Pressure and Heart Medications. Now let's talk about medications that are actually meant to protect the heart. Blood pressure and heart medications. For millions of seniors, these medications are essential. They help control blood pressure, protect blood vessels, and reduce the risk of heart attacks and strokes. Many people live longer and healthier lives because of them. That part is important to say clearly. But here's the issue that often gets overlooked. As the body changes with age, the same dose that once worked perfectly can sometimes become too strong. Not because the medication is wrong, but because the body it's acting on is different now. After 60, blood vessels become more sensitive. The kidneys manage fluids differently, and the nerves that help regulate blood pressure may respond more slowly. Because of these changes, blood pressure can sometimes drop more quickly than the body can comfortably handle, especially when standing up or changing position. This is often how it shows up. You stand up and feel lightheaded for a few seconds. You feel unusually weak in the morning. Walking short distances suddenly feels more tiring than it used to. Sometimes the heart rate may even feel slower than normal. Many people stop questioning these symptoms and simply adjust their routine. Another factor is medication combinations. Many seniors take more than one heart or blood pressure medication. One pill may lower fluid levels, another relax blood vessels, and another slow the heart rate. Each medication may be appropriate on its own, but together they can sometimes lower blood pressure more than intended. There's also an issue many people never consider: nighttime blood pressure. If medication lowers blood pressure too much during sleep, blood flow to the brain and heart can temporarily drop overnight. The warning signs often appear the next morning as dizziness, weakness, or unsteadiness when getting out of bed. None of this means these medications should be stopped suddenly. What it means is that regular medication reviews become increasingly important after 60, making sure doses and combinations still fit the body you have today. And that brings us to the final pill on this list, the one that affects more seniors than any single medication. Pill 5, polypharmacy. Now we come to the most important pill on this list, and it isn't a single pill at all. It's something doctors call polypharmacy. Polypharmacy simply means taking several medications at the same time. For many adults over 60, that number is 5, 6, or sometimes even more pills taken every day. And this is often where the real risk begins. Each medication may have been prescribed for a good reason. One pill may be for pain, another for sleep, another for blood pressure, maybe one for the stomach, cholesterol, or blood sugar. Individually, each prescription can make sense. The challenge is what happens when all of them interact inside an aging body. Medications don't work in isolation. One pill may lower blood pressure, another may slow the heart, another may affect fluid levels, and another may influence the nervous system. When several of these effects overlap, the body can be pushed further than any single medication would cause on its own. For the heart, this can create extra strain. Blood pressure may drop too low at certain times of the day, heart rate may slow more than expected, fluid balance can shift, and oxygen levels during sleep may fluctuate. None of this usually happens suddenly. It builds gradually, which makes it easy to overlook. That's why polypharmacy often shows up as confusing symptoms. You feel tired, but not sick. You feel dizzy sometimes, but not always. You feel foggy in the morning, but better later in the day. Because these symptoms seem scattered, people often assume they're simply part of aging. Older bodies process medications differently. The liver breaks drugs down more slowly, the kidneys clear them less efficiently, and the nervous system becomes more sensitive. Medications that once worked smoothly may start overlapping in ways that stress the heart and brain. That's why after 60, the combination of medications matters just as much as the individual prescription. If there's one message I hope you remember from this video, it's this: awareness matters. After 60, heart safety isn't only about adding the right medication, it's about making sure the medications you already take still fit your body today. Over time, the body changes. The heart, kidneys, and nervous system all become more sensitive. Because of this, a medication that once worked perfectly can begin affecting the body in new ways. The most important step is not stopping medications suddenly. The real step is reviewing, looking at the full list, paying attention to patterns in how you feel. When you wake up, when you stand, during walks, or late in the evening, small symptoms like dizziness, fatigue, swelling, or unusual weakness often carry information your body is trying to give you. Many seniors spend years adding medications to their routine, but sometimes the biggest improvement comes from stepping back and asking whether the list still makes sense. Adjusting timing, doses, or combinations can sometimes restore energy, steadiness, and confidence without adding another pill. So here's a simple question to think about. When was the last time your full medication list was carefully reviewed? We're building a community here to support your strong, healthy comeback. If this helped you, I'd truly appreciate a like, and if you subscribe, also share it with someone you love. And join me in the next video for another simple step toward better health.